Deep within the familiar landscape of our kitchens, nestled perhaps between the flour and sugar, sits a simple box or jar filled with a fine white powder. We know it as baking soda. For many of us, especially those who've spent years nurturing a home, it's an old friend, the secret to a perfectly risen cake, the gentle scourer that lifts tea stains from cherished cups, maybe even the quick fix for a lingering odor in the refrigerator. It seems so ordinary, doesn't it? Tied to the everyday tasks of hearth and home. But have you ever paused and wondered why sometimes, in quiet conversations, or perhaps passed down through generations, we hear whispers about another use for this common powder? Murmurs about stirring a little into water and drinking it for an unsettled stomach, for that fiery sensation rising in the chest, or even more intriguing, claims of benefits that sound almost too good to be true. How can something so inexpensive, so readily available, possibly hold secrets related to our health? Does the thought spark your curiosity, maybe even a healthy dose of skepticism? Why would a baking ingredient, a household cleaner, find its way into discussions about well-being, about improving how our bodies function? Could it be a forgotten folk remedy, a simple yet effective secret hiding in plain sight? Or, beneath that simplicity, could there be hidden complexities, things we absolutely must be aware of, especially as the years bring natural changes to our bodies? This isn't a straightforward question. And the truth is, a great deal of information circulates about drinking baking soda water, some of it accurate, some misleading, and some downright contradictory. One person might praise it enthusiastically, while another warns sternly of its risks. So, where does the truth lie? Understanding baking soda, it's more than just bubbles. Before we delve deeper, let's spend a moment getting acquainted with our main subject from a scientific perspective. But let's keep it simple and clear. The names, baking soda, or perhaps bicarbonate of soda, are common terms for a chemical compound called sodium bicarbonate. You don't need to memorize the chemical name. What's crucial is understanding its fundamental nature. It's a type of salt. The most important characteristic, the one that underpins both its potential benefits and its potential risks, is that baking soda is alkaline. Think of it this way: if lemon juice is sharp, sour, and strongly acidic, baking soda is its opposite. It's not sour, it has a slightly salty taste and possesses alkaline properties. This alkalinity is why, if you mix baking soda with something acidic like vinegar, it fizzes and bubbles vigorously. That's a simple chemical reaction, the alkaline baking soda neutralizing the acid. Our bodies, to function at their best, maintain a very delicate balance between acidity and alkalinity, especially in our blood and other fluids. This internal environment is usually slightly alkaline. When this balance is disrupted, perhaps becoming too acidic, a state called acidosis, various health problems can arise. It's from this basic chemical property, the ability to neutralize acid due to its alkalinity, that people first started experimenting with baking soda for health issues related to excess acid, such as heartburn caused by stomach acid reflux. And from that starting point, many other purported uses and claims have spread, making the picture surrounding baking soda much more complex. Our goal today: balanced information, safety first. Ladies and gentlemen, as someone working in the medical field, I understand the natural desire to find simple, effective, and safe solutions for maintaining your health and the health of your loved ones. Exploring an accessible remedy like baking soda water is perfectly understandable. However, precisely because it is so simple and common, information about baking soda can sometimes be exaggerated, or critical warnings can be overlooked. The purpose of our conversation today isn't to declare baking soda a miracle cure, or to dismiss any potential it might have entirely. Instead, our goal is to examine it together, through the careful lens of medical understanding, in a balanced way. Potential benefits: what positive effects might baking soda water have on the body under specific circumstances? What are the proposed mechanisms behind these effects? Risks and limitations. More importantly, what are the potential dangers of using baking soda? Who should absolutely avoid it? When is it necessary to stop? Guidance for use. If considered, if one chooses to consider using it, what dosage, preparation method, and frequency are most reasonable and minimize risks? I must emphasize that all the information we'll discuss is for educational and reference purposes only. It cannot and should not replace a personal consultation and advice from your own doctor or healthcare provider. Each of us is unique, with different health histories, underlying conditions, and medications. Your safety must always be the top priority. In the sections that follow, we will explore each of these aspects in detail, from examining the most commonly mentioned benefits to clearly outlining the red flags and safe usage guidelines, concluding with crucial summary advice. Let's embark on this journey of understanding together, with caution and a commitment to reliable information. So, we've established that this familiar white powder, baking soda, or sodium bicarbonate as it's scientifically known, has a special property: it's alkaline. It's the opposite of acidic things like vinegar or lemon juice. And it's this very alkalinity, its ability to neutralize acids, that lies at the heart of why people sometimes turn to it hoping for health benefits. Let's explore some of the most common things you might hear about, looking at them with a careful, balanced eye. Perhaps the most well-known use is for tummy troubles. Many people have reached for baking soda when they feel that uncomfortable burning sensation rising up from their stomach, what we call heartburn or acid reflux. It happens when the strong acid our stomach naturally produces to digest food splashes back up where it shouldn't be, irritating the sensitive lining of the esophagus, that tube leading down from your throat. Now, because baking soda is alkaline, when you drink a little bit dissolved in water, it does indeed react with that stomach acid. Think of it like adding a calming agent to something overly active. It neutralizes some of the acid, making the stomach contents less acidic for a short while, and that often brings pretty quick relief from the burning feeling. It works on the same principle as many over-the-counter antacid tablets you might buy. Similarly, for those times you feel uncomfortably full, bloated, or have mild indigestion after maybe eating a bit too much or too fast, some find that a little baking soda water can help settle things down. Again, it's likely due to that same neutralizing effect on excess stomach acid. But here's the important thing to understand, something I always emphasize: while baking soda can offer this temporary relief, like putting a quick bandage on a scrape, it doesn't fix the underlying reason why you might be getting frequent heartburn or indigestion. If these problems happen often, it's really important to talk to your doctor to find out the root cause. Relying on baking soda regularly isn't a good long-term strategy. It doesn't heal any irritation, and using it too much can actually disrupt your stomach's natural function, and, as we'll discuss more later, carries other risks because it contains sodium. So, think of it as an occasional helper for sudden discomfort, not a daily solution. Now, let's move into some areas where the connection between baking soda and health gets a bit more complex, and where using it requires much more caution, sometimes even strict medical supervision. You might sometimes hear discussions about baking soda in relation to kidney health. Our kidneys are truly amazing organs. They filter waste from our blood day in and day out, and they're crucial for keeping the body's delicate acid-base balance just right. In certain types of chronic kidney disease, the kidneys can struggle to get rid of enough acid, leading to a state called metabolic acidosis, where the body becomes too acidic overall. This acidic state, unfortunately, can put extra strain on the kidneys and potentially make the disease progress faster. Because baking soda is alkaline, doctors, specifically kidney specialists or nephrologists, sometimes prescribe sodium bicarbonate under very careful monitoring. The idea is to help neutralize that excess acid in the bloodstream, potentially easing the load on the struggling kidneys. Some studies have looked into whether this can help slow down the decline in kidney function for some patients. However, and this is incredibly important, please listen closely. This is absolutely not something anyone with kidney problems should ever try on their own. Baking soda is loaded with sodium. If your kidneys aren't working well, or if you also have high blood pressure or heart failure, which often go hand in hand with kidney disease, adding extra sodium can be incredibly dangerous. It can cause your body to hold on to fluid, push your blood pressure dangerously high, and put immense strain on your heart. Using baking soda for kidney support should only happen if it's specifically prescribed by a kidney specialist who is monitoring your blood tests and overall condition very, very closely. Self-treating here can have truly serious consequences. Another area where baking soda is sometimes mentioned is in relation to gout. Gout, as many know, is a very painful type of arthritis that flares up when sharp crystals of uric acid build up in the joints, often starting in the big toe. Now, uric acid tends to form these painful crystals more easily when the surrounding environment, like your urine, is more acidic. It dissolves better and is flushed out more easily when the environment is more alkaline. So, the thinking goes that by drinking baking soda water, you might make your urine more alkaline, helping your body dissolve and get rid of uric acid more effectively, possibly reducing how often you get those painful gout attacks. Some research even suggests it might be a helpful addition alongside standard gout medications for certain people. But again, let's be very clear, baking soda is not a cure for gout. It doesn't replace the important medications your doctor prescribes to control uric acid levels or treat flare-ups. If you have gout and are curious about this, please talk to your doctor first. They need to consider your kidney function, your blood pressure, and any other medications you're taking before advising if this is even a safe option for you to consider as a potential complementary measure. It's never something to do instead of your prescribed treatment. Let's shift gears to some simpler, more topical uses. How about freshening your breath? Sometimes bad breath is caused by bacteria in the mouth that produce smelly compounds, and these bacteria often thrive when the mouth is more acidic. Rinsing your mouth with a diluted solution of baking soda water can help neutralize those acids temporarily, making the environment less friendly for these odor-causing bugs. It might give you a fresher feeling for a short time. Of course, this doesn't replace the cornerstones of good oral health: brushing thoroughly twice a day, flossing regularly, and seeing your dentist for checkups. Persistent bad breath needs a professional look. Similarly, for minor irritations like a small canker sore or a mildly scratchy throat, not a serious infection, mind you, gargling or rinsing with a very weak baking soda solution might feel soothing. Its mild alkalinity can help neutralize acids that might be irritating the sore spot, and the rinsing action gently cleanses the area. Just remember to use a very diluted mix, maybe a quarter teaspoon in half a glass of water, and don't swallow it. For anything more than a minor irritation, or if things don't improve quickly, it's always best to seek medical advice. What about exercise? You might hear athletes talk about using baking soda. When you exercise intensely, your muscles produce lactic acid, which contributes to that muscle burn and the soreness you might feel the next day or two. Because baking soda can buffer acids, there's some thought, and some studies have explored whether taking it before strenuous activity might help counteract that acid buildup, perhaps delaying fatigue or reducing soreness afterwards. The evidence is a bit mixed, and it seems more relevant for short bursts of very high-intensity exercise. Plus, trying to time it right and taking enough to potentially have an effect can often lead to an upset stomach, bloating, or diarrhea, not ideal before or during exercise. For most of us looking to ease everyday muscle aches, focusing on good hydration, gentle movement, rest, and proper nutrition is usually the safer and more reliable approach. Now, there are a couple of other things sometimes mentioned where we need to tread even more carefully. Urinary tract infections, or UTIs, are one. The idea, similar to gout, is that making the urine more alkaline might make it harder for the bacteria causing the UTI to grow. Some people might try it hoping to ease the burning sensation. But let me state this very firmly: baking soda is absolutely not a treatment for a UTI. UTIs are bacterial infections that usually need antibiotics prescribed by a doctor to be properly cured. Relying on baking soda instead of getting proper medical treatment can be dangerous, allowing the infection to potentially worsen or even travel up to your kidneys. If you think you have a UTI, please see your doctor right away. And what about skincare? This is for external use only. Taking a bath with maybe half a cup of baking soda dissolved in lukewarm water, or applying a paste made with a little water, is a common home remedy for soothing itchy skin from things like insect bites, poison ivy, or mild sunburn. Its mild alkalinity might help calm the irritation. Just be sure to use lukewarm water, don't soak for too long, and maybe test it on a small patch of skin first if you're sensitive. Never apply it to broken or infected skin. It's just for minor, temporary relief. Finally, I need to address something you might occasionally see online or hear about concerning baking soda and cancer. Sometimes, very preliminary research, often just in labs or in animals, looks at how changing the acidity right around tumor cells might affect them. Cancer cells do tend to create a more acidic environment around themselves. However, and please hear this very clearly, baking soda is now a cure for cancer. It is now a proven or safe cancer treatment. The research is extremely early and complex. Trying to treat cancer by drinking baking soda is ineffective and can be very harmful. It can interfere with legitimate, evidence-based cancer treatments prescribed by oncologists and cause serious imbalances in your body. Please rely only on the advice and care of qualified cancer specialists for cancer treatment. So, as we've journeyed through these potential uses, you can see a pattern. While baking soda might offer some temporary relief for simple issues like occasional heartburn, or have some mild external uses, many of the bolder claims lack strong evidence or apply only in very specific medical situations requiring a doctor's oversight. And woven through all of this is the constant reminder about the risks, particularly related to its sodium content and its potential to upset the body's natural balance. This naturally leads us to the next crucial part of our conversation: how should one use it, if at all, to maximize safety? And most importantly, who needs to be especially careful or perhaps avoid it altogether? Let's turn our attention to those vital guidelines now. All right, we've talked about what baking soda might do, and importantly, the many reasons for caution. Now, let's say you've considered everything, perhaps even discussed it with your doctor for a very specific, occasional use like sudden heartburn, and you're thinking about how to prepare it. How do you do it safely? This part is crucial because how you use it makes a big difference. First, let's talk about the amount, the dosage. With baking soda, less is definitely more. If you're trying it for the very first time, I'd suggest starting extremely small, perhaps just a tiny pinch, maybe only 1/4 of a level teaspoon. See how your body reacts to that minimal amount. If you tolerate that well, and only if you need it again for an occasional bout of discomfort, the generally accepted maximum dose for infrequent use is no more than 1/2 of a level teaspoon. Please, measure carefully, don't just guess or scoop generously. And I must stress, this 1/2 teaspoon limit is really the ceiling for occasional, self-directed use. Going beyond that significantly increases the risks we'll talk more about soon. Next, how do you prepare it? Take your measured amount, that 1/4 or 1/2 teaspoon, and add it to a glass containing about 6 to 8 ounces, that's roughly 150 to 200 milliliters of water. Regular room temperature or slightly lukewarm water is best. Avoid very cold or very hot water. Now, this next step is very important. Stir it thoroughly until the baking soda is completely dissolved. You shouldn't see any white powder settled at the bottom or feel any gritty texture when you drink it. Why is this important? Undissolved baking soda can be quite irritating to your stomach lining. Making sure it's fully dissolved helps it mix better with your stomach fluids and reduces the chance of causing irritation or cramping. What about when to drink it? There are generally 2 approaches people take, depending on the reason. Some prefer to drink it first thing in the morning on an empty stomach, perhaps 20-30 minutes before breakfast. The thought here is that it might be absorbed more quickly and have a more general effect on the body's pH balance. Though, as we've discussed, the real impact on overall body pH from occasional use is debatable and likely minimal. Others choose to take it about 1 to 2 hours after a meal, specifically aiming to counteract that feeling of indigestion or heartburn that sometimes follows eating. If you choose this timing, remember our earlier caution. This shouldn't become a routine after every meal. Now, we arrive at perhaps the single most critical point regarding safety: frequency of use. How often should you drink this? My strongest advice here is this is not something to drink every day. Please, think of baking soda water as a remedy for occasional, infrequent discomfort, not as a daily health tonic or supplement. Using it day after day, even in small amounts, is where the risks really start to add up. Why? Because you're continuously adding extra sodium to your system, which can raise blood pressure, cause fluid retention, especially if you have heart or kidney concerns, and potentially disrupt the delicate balance of electrolytes, those essential minerals like potassium, in your body. It can also chronically alter your stomach's natural acidity, which is needed for proper digestion and nutrient absorption in the long run. So, how often is occasional? It's hard to give an exact number, but certainly not daily. Maybe a few times a week at the absolute most, and ideally, only when you actually experience the specific symptom you're trying to address, like that sudden heartburn. It's intended for short-term relief, perhaps for a day or two if needed, but not for continuous use over weeks or months without specific medical guidance. If you find yourself needing it frequently, that's a clear signal that you need to see your doctor to understand and treat the underlying problem, not just mask the symptom. Finally, and this applies to anything we introduce into our bodies, listen to your body. Pay attention to how you feel after drinking it. Do you feel more bloated? Do you get cramps or feel nauseous? Does it seem to upset your digestion later in the day? If you experience any discomfort or negative effects, stop using it immediately. Your body often gives you signals when something isn't quite right. So to recap, the safe use guidelines start with a tiny dose LOS 124 sp. Never exceed half a teaspoon per serving. Dissolve it completely in water. Use it only occasionally, never daily, for short-term relief. And stop if it causes any unpleasant symptoms. Following these steps helps minimize the immediate risks. But even with these precautions, there are still people who should be much more careful or avoid baking soda water altogether. And that brings us to our final, and arguably most vital, section: the crucial warnings and contraindications. Let's discuss who really needs to steer clear of this. We've now discussed what baking soda might potentially do, and how to approach using it cautiously if you choose to for those very limited situations. But now we come to the most important part of our conversation, the part where we talk about who absolutely needs to be extra careful, or perhaps shouldn't use baking soda water at all, and why understanding these warnings is paramount for your health and safety. Please listen very carefully to this section. There are certain health conditions where adding extra sodium bicarbonate, even in small amounts, can pose significant risks. If you have any of the following conditions, using baking soda water without explicit discussion and approval from your doctor is strongly advised against. First, anyone with heart problems. This includes conditions like high blood pressure, hypertension, or heart failure, congestive heart failure. Why? Remember, baking soda is sodium bicarbonate. Sodium makes your body hold on to water. For someone with high blood pressure, this extra fluid volume can push blood pressure even higher, making it harder to control. For someone with heart failure, whose heart muscle may already be struggling to pump effectively, forcing it to handle extra fluid load can worsen symptoms like shortness of breath, fatigue, and swelling edema in the legs and ankles. It can put a dangerous strain on an already vulnerable heart. So, if you have any heart condition, please avoid baking soda water unless your cardiologist specifically discusses and approves it, which is unlikely in most cases. Second, anyone with kidney disease or impaired kidney function. As we touched upon earlier, healthy kidneys are responsible for filtering waste, balancing electrolytes, and getting rid of excess sodium. If your kidneys aren't working at full capacity, they struggle to handle an extra load of sodium. This can lead to fluid buildup, worsening blood pressure, and potentially dangerous shifts in your body's electrolyte balance, like potassium levels. Even if your kidney issues are mild, adding unnecessary sodium is generally unwise. Again, this is something only a kidney specialist should ever manage, if appropriate at all. If you have any known kidney problems, including kidney stones, stay away from self-prescribing baking soda water. Third, anyone who is currently experiencing swelling, edema, or fluid retention, regardless of the cause. Baking soda will likely make this worse due to its sodium content, drawing more water into your system. Fourth, anyone on a strict low sodium or salt, restricted diet for any medical reason. Just half a teaspoon of baking soda contains a significant amount of sodium, over 600 milligrams. That can easily blow your daily sodium limit and counteract the very purpose of your restricted diet. Fifth, women who are pregnant or breastfeeding. There simply isn't enough safety data to recommend its use during these sensitive times. the potential risks of fluid retention, electrolyte shifts, or unknown effects on the baby outweigh any perceived minor benefits. It's best to err on the side of caution and avoid it. Sixth, individuals with certain liver conditions, such as cirrhosis, as they often have difficulty managing fluid and sodium balance. And finally, anyone currently experiencing undiagnosed severe abdominal pain, nausea, vomiting, or symptoms suggestive of a bowel obstruction. Using baking soda in such situations could potentially be harmful or mask a serious underlying issue that needs immediate medical attention. Beyond these specific conditions, we need to talk about interactions with medications. Baking soda can interfere with how your body absorbs or uses other medicines you might be taking. How? Well, by changing the acidity pH level in your stomach, it can affect how well certain drugs dissolve and get absorbed into your bloodstream. Some medications need an acidic environment to be absorbed properly, while others are affected by changes in alkalinity. Furthermore, the high sodium load can interact negatively with medications used to manage blood pressure, heart conditions, or diuretics, water pills. It might make some medications less effective or increase the risk of side effects. Which specific drugs? The list can be long and includes common things like certain antibiotics, iron supplements, antifungal medications, aspirin, medications for heart rhythm, blood pressure pills, and even other antacids. The key takeaway isn't to memorize a list, but to understand the potential for interaction. This is why it is absolutely vital that you tell your doctor or pharmacist about everything you are taking: prescription drugs, over-the-counter remedies, vitamins, herbal supplements, and yes, even if you're occasionally using something like baking soda water before starting any new medication or remedy. They need the full picture to advise you safely. Don't assume something simple like baking soda won't interfere; it sometimes can. Now, what about side effects and the risks of using too much or too often? Even for generally healthy people, overuse can cause problems. Common immediate side effects, especially if you drink it too quickly or haven't dissolved it fully, include bloating, gas, and belching. This happens because the reaction between baking soda and stomach acid produces carbon dioxide gas. More concerning, especially with higher doses or prolonged use, are risks like nausea, vomiting, stomach cramps, or diarrhea. More seriously, it can lead to an imbalance in your body's electrolytes, particularly lowering potassium levels, which can cause muscle weakness, cramps, or even heart rhythm problems. It's also possible, though less common with typical small doses, to develop a condition called metabolic alkalosis, where the body becomes too alkaline. Symptoms of this can range from confusion and muscle twitching to tingling, spasms, and in severe cases, seizures. And of course, there's the risk of sodium overload, leading to the fluid retention and increased blood pressure we've already discussed. These risks become much more real if you ignore the dosage limits and frequency guidelines we talked about. So, as we wrap up our conversation, what are the key messages I hope you'll take away, speaking from a medical perspective focused on your long-term health and well-being? First and foremost, please understand that baking soda is not a magic potion or a cure-all. It's a simple chemical compound with specific properties. Second, while it might offer temporary relief for very specific, minor issues like occasional heartburn, these potential benefits must always be weighed against very real potential risks, especially for individuals with pre-existing health conditions. Third, your safety is always the top priority. Never prioritize a potential minor benefit over the risk of a significant health complication. Don't experiment with your health based on anecdotal stories or unverified claims you find online. Fourth, remember that the true foundation of good health, especially as we age, lies in consistent, evidence-based lifestyle choices. Eating a balanced diet rich in fruits, vegetables, and fiber, drinking plenty of plain water, getting regular, appropriate physical activity, managing stress, getting enough sleep, and importantly, having regular medical check-ups and following your doctor's advice for managing any chronic conditions. These are the pillars that truly support your well-being far more effectively and safely than occasionally drinking baking soda water. And my final, most crucial piece of advice: treat baking soda water as, at best, a very limited tool for occasional, specific use, if appropriate for you at all. Before you even consider trying it, especially if you have any underlying health issues or take any medications. Please have an open and honest conversation with your doctor or pharmacist. They are the only ones who can properly assess your individual situation, understand potential risks and interactions, and give you personalized, safe advice. They are your partners in health. Thank you for taking the time to explore this topic with me today. My sincere wish is that this information helps you make informed and, above all, safe choices for your health. Take good care of yourselves.